Hi, are you Michelle?
Yes.
Hi, I'm Michael. I'm one of the students here today. Do you mind if I follow you around?
Yeah, sure.
Can you give me an S-bar on your patient you're about to see?
Yes, we're taking care today of Marty Yarn. She's Hispanic. She's 80 years old. She's a full cold. She got admitted today because of the sacral wound. She has a non-healing sacral wound at stage 3. Her vital signs are her blood pressure is 144/90. Her pulse is 88. Her respiratory is 24. Her temperature is 99. She was in pain. She stated she was a 6 in a scale 0 to 10. But she's alert and oriented. She just had a little hard of hearing. But besides that, her chest is symmetric, her lungs are clear, her abdomen is soft and non-tender. She has the bound sound activated in all the 4 quadrants. Because of the IV bag, they ordered the garamycin for her, the antibiotic. And she's also in a sodium chloride with potassium chloride. The recommendations is then we will check her vital signs every 4 hours. She will be consulted with a wound care and consult with the dietary tomorrow after the surgery. Tomorrow after surgery, we will need to teach her about the preparation and post-operative care. I'm going to teach some later. And by midnight, she needs to be NPO because of the surgical.
Okay. Why specifically is the client receiving this medication?
Because the test came as gram negative, so they ordered the antibiotics, and this will help treat the infections.
Okay. What action does the medication have on the body?
It will stop the growth of the bacteria.
Oh, good. When should you question administering the medication?
If the person is allergic to aminoglycoside antibiotic, such as the tobramycin and amikacin, and any signs of infection, like fever, diarrhea, those signs of infection.
Okay. Does the medication have a therapeutic serum level?
Yes. It peaks 4 to 10 per and troch 0.5 to 2 micrograms.
Okay. And which vital signs must be monitored?
We will monitor all the vital signs, but we want to just make sure more signs for infiltration of her IV. She has the IV on the right side, and so we will look like for swelling, pain, redness.
Okay. And which physiological parameters must be monitored when the medication is being administered?
Allergic reactions.
Okay.
If she has any rash, itching, this might occur, but we just want to, if it persists or if it gets worse, then we want to
Okay.
watch it.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
We want to teach the patient about signs of the infiltration. We're going to give to her information about the medication, side effects, and we're just going to teach her.
And what interventions must be taught for taking the medication safely at home?
She's probably not going to take that medication because it's the IV, but they're probably going to...
Okay.
She's probably not going to take her own.
What are the side effects and potential adverse reactions?
side effect will be the allergic reactions, and it, she can have maybe some itching and rash, but we just need to keep an eyes on and see if it will get worse or if it will be for a long time, if it will persist.
Okay, and how will you know the medication has been effective?
We will watch it for the lab values. Like now she has an increase in her white blood cells because of the infection. So we will watch the white blood cells, and if the lab shows then the bacteria back to normal.
Okay, well, those are all the questions I have for now.
Are you ready to go in? And
Sure. Get out of here. Wait.
okay. Go in. Hi, Marta. How are you? I'm Michelle. I'm gonna be your nurse today. Okay. Just make sure. Can you tell me your name and age, please?
Marta Yarn. I'm 80 years old.
Do you have any allergies?
No, I don't.
Okay. I'm just gonna make sure. Marta. How are you feeling today, Marta?
I'm okay.
Do you remember when I told you about the signs of your IV? Signs for infections?
Oh, you mean like if it's red or swollen?
And that's what I'm gonna make sure now. I'm gonna make sure it is not red, it's not swollen, it's not warm, it's not anything. Okay? Good. So we're gonna do the potassium, sodium chloride with potassium. We're gonna make sure, we're gonna look for any leaks, we're gonna see if it's clear, we're gonna check for the expiration date, and we're going to, how we don't have the scan, so we have to add by hand. Patient's ID.
Make sure everything gets put back in the cart. I hope so. Make sure everything gets put back in the cart, guys.
Okay, we got the green light. We're gonna put it where is the site? Is in the right dorsal metacarpal. And we're gonna put the time. So we already checked for the bag. Now it's known that this is a sterile. The spike will be sterile. So I'm gonna remove. You want to make sure it's clean. It is clean for it. Open. We don't have the pump today. We are going to use the dial today. How this is new, we don't need it to clean. Both are new, we don't need to clean. We're gonna put it for, she's gonna receive 125 mLs per hour. Marta, can you tell me your name and age, please?
Yes, it's Marta Yarn, and I'm 80 years old.
Okay. And any allergies?
No.
We will make sure this is clamped too. Just want to put in. Let's just put it on. For now, we'll unclamp here. And we're gonna do the same thing with the bag. We're gonna check the bag for expiration date to see if it's clear, to see if it has any leak or anything. still having any pain, Marta? Marta?
No.
Good. And you just let us know if you have any pain, because you have a PRR, a medication for if
I'll
you
let you
pain.
know.
Okay, I just need the patient ID number again. 5110. 9056. Okay. And we got the green light. And we're gonna hang out. How are we going to do the second line? The highest one, it will run first. So how we want to do the antibiotic ones first? We're gonna put it. Potassium chloride here. Remember, this is sterile. We don't want to touch or anything anywhere. We're gonna spike. We're gonna make sure it is clamped. It is clamped. Okay. Here. Now we're always gonna look for bubble. We don't want any bubbles. And always be careful because we don't want to lose the medicine, especially in a small bag. In a small bag. So now we're gonna put it aside. We're gonna go here. We're gonna for 15 seconds. Okay. Making sure what she's getting. Anything is clamped, nothing is clamped, so she's good. And open. And now we're gonna put it with 100. Okay, then put it here. We're gonna unclamp. And she's getting her medication. I'm gonna set up my watch to come back because how we don't have the pump, we will not know when the medicine is done. So we're gonna come back. And before we leave the room, we make sure we have 5 drops. We'll make sure we have the 5 drops of the medicine before we leave the room. And so Marta, is anything else that I can help you today?
No, I don't think so.
Then, okay, so, and we always want to make sure then we will tape with our name, date, and initials. Both lines. It was already ready, so. Okay. I also print the new antibiotic, then you take some information, and if you want to read it, and if you have any question, I will be able to answer when I come back.
Okay, great. Thank you.
Is there anything else that I can help you, Sandra?
I don't think so.
Okay. Thank you, Marta, and I'm gonna wash my hands.
Just had a couple more questions for you.
Mm-hmm.
Were there any pertinent pieces of information you reviewed before administering the client this medication?
We just make sure that her thought was good, and just we watching
Did this information affect your decision to administer the medication?
yes, because if the levels were not right, we will not administer the medication, and we also how she's having the potassium chloride. We want to make sure her potassium levels are good before we administer anything.
Okay. And just finally, did this information affect how you administered it?
No, not
Thank
with
you.
this medication. But
That's
I'm
all
just
I
gonna
have.
keep documenting if you wanna watch me.
Okay, thank you.